Okay, today we're going to talk about a small Australian biotech company called Amplia Therapeutics. And the reason we're talking about them is because they've produced some clinical results in pancreatic cancer that are so astonishing, they could completely change how we treat one of the world's deadliest diseases. And, from an investment standpoint, it really seems like the market just hasn't caught on yet. So let's get into it. You don't hear an experienced oncologist say something like that every day. That's a real quote from Dr. Prasad Kure after he saw the results from a patient in a recent trial. When you hear something like that, it's a huge signal that something truly, truly remarkable has just occurred.
And here's why he was in disbelief. A patient with metastatic pancreatic cancer, and that's a kind that has already spread, had what's called a pathological complete response. What does that mean? It means after the treatment, the pathologist went in and they couldn't find any detectable cancer cells. Gone. This is something that's basically unheard of for this disease. It's a kind of thing that happens so rarely, it's a fluke. But this trial is starting to make it look like it could be repeatable.
So, what is behind this incredible breakthrough? Let's take a look at the company and the actual drug that's making this all possible. The drug itself is called narmafotinib, or AMP945 for short. It's from the small Aussie company Amplia Therapeutics. Now, the really crucial thing to understand here is that AMP945 wasn't used by itself. It was given with the normal standard of care chemotherapy. And that little detail is absolutely key. We're going to come back to that later. So how does this thing actually work? Well, the science behind it is it's incredibly smart. It's less about a direct brute force attack on the cancer, and more like using clever military tactics to outsmart the tumor. Narmafotinib is what's called a FAK inhibitor. Now I know, that's a mouthful, but hang with me. FAK is a protein that pancreatic tumors use to build this thick, fibrous shield all around themselves. It's like a bunker. And this bunker protects the cancer cells, and, more importantly, it blocks chemotherapy from getting inside to do its job. So what a FAK inhibitor does is it basically dismantles that bunker. It takes down the shield. And this image here shows it perfectly. You can see the cancer cells in pink, and they're just surrounded by that protective wall, that white fibrotic tissue. So what's so cool is that narmafotinib doesn't even attack the cancer directly. All it does is break down that wall, opening the gates so that the tried and true chemotherapy can rush in and just wipe out the cancer much, much more effectively. It's brilliant. So, that's the theory, but a good story in the world of biotech is absolutely worthless if you don't have the data to back it up. So let's turn to the clinical results because this is where the story gets really, really good. First, let's look at what's called the objective response rate, or OOR. All that means is, in how many patients did the tumor actually shrink? Well, in the trial, the combo of AMP945 and chemo hit a rate of almost 36%. That's a huge improvement over the historical benchmark of 23% for just chemo by itself. So point number one, more tumors are shrinking. But, shrinking tumors is only half the battle. The real goal is to give people more time. And here, we're looking at median overall survival. Patients who got the combination therapy lived for a median of 11.1 months. Compare that to just 8.5 months for the standard treatment. We're talking about an extra 2.6 months of life. For a disease this aggressive, that is a massive leap forward. And that brings us to the most incredible number of them all, 7.8%. This was the confirmed complete response rate in the trial. This means for nearly 8 out of every 100 patients, the cancer became undetectable, just gone. And to really put that number into perspective, here's a quote from the brokerage firm Bell Potter. Historically, with normal chemo, a complete response was seen in maybe 1 out of every 500 patients. That's a rate way, way below 1%. Amplia is delivering a rate of 7.8%. This isn't just a small improvement, it's a completely different reality. You can see why people are starting to get very excited. Which, of course, brings us to the core of the investment idea here. When you have data this groundbreaking, you'd expect the company to have a sky-high valuation. But with Amplia, there seems to be this massive disconnect between the science and the stock price. As of the last market close, Amplia Therapeutics had a market cap of just over 123 million Australian dollars. I mean, let that sink in for a second. For a company that might be holding the next standard of care for pancreatic cancer, that number just feels unbelievably low. So this slide really frames the whole opportunity. The current value is sitting there around 123 million. But when you look at clinical data this powerful, the argument is that this company is a compelling buy at any valuation under $500 million. That suggests there's some serious room to grow as the market finally wakes up to what's happening here. And hey, you don't have to take my word for it. Just look at the analyst price targets. Bell Potter have a target of 42 cents. That implies almost 80% upside from where the stock has been trading. The average of all analysts is even a little higher. The consensus here is crystal clear. The professionals who cover this stock for a living believe it is deeply, deeply undervalued. So where does this all lead? What's the end game? Well, for a small biotech company that has a game-changing asset like this, the most logical path forward is almost always getting acquired by a big pharmaceutical giant. Let's talk about why that's so likely to happen here. There are really four big reasons why Amplia is such a perfect target for a buyout. First, and this is the most important one, narmafotinib makes the current standard of care better. It's not a replacement, it's an enhancer. This makes it a perfect bolt-on for a big company that already sells those chemotherapy drugs. They could package it all together and basically own the entire treatment space for years. Second, the data is just off the charts good. Third, the drug has FDA Fast Track designation, which seriously speeds up its path to market. And finally, the whole FAK inhibitor market is growing at 15% a year. It's the right drug in a hot sector with incredible data. So here's the bottom line. You have a small company with a drug that has produced results that are almost unheard of in one of the toughest areas of cancer research. It has a clear path to market and a strategic logic that just screams buyout to big pharma. With a potential new standard of care right around the corner, the real question isn't if an acquisition is going to happen. It's just a matter of when and for how much.